Good morning, everyone. Good morning or good afternoon, depending on where you are calling in from.
Good morning.
We're happy that you're on the call today. We'll wait just maybe one more minute and see if anyone else joins us. So if you have colleagues that you think might be on, if you want to send them a reminder, that'd be awesome. And we will get started in just a minute. Wonderful. We're getting a few more people on. That is great. As you all know, we have a little bit of a different format today, or a different focus, which is really hearing from you all about your progress on the priorities that you selected almost a year ago, which is hard to believe. And we are anxious to hear directly from your representative from your country about the progress you've made. We're doing it in a little bit of a fun way. We're having you imagine that you are kind of caught unawares in a taxi with your Minister of Health, and your minister actually remembers that you were on this echo. So, and he wants an update, or she. All right. Nope, keep on seeing folks join, so we'll just wait just another minute for a few seconds. Again, if possible, we always love to be able to see your faces, so if possible, turning on your video camera would be great. Thank you. Thank you.
And Annette, thank you for introducing yourself. If everybody could do that too in the chat, that would be great, especially if you have other people in the room with you. You know, sometimes you do.
Awesome. We are getting a full house today. This is great. Annette, it's always always a shock to see your hair so different now. I'll get used to it. It's very cute. It's just so different. All right, well, let's go ahead and get started. Again, if you can turn on your video, please do. Also, again, please introduce yourself in the chat. I think after almost a year now, hopefully we all know each other. But just to get started, I'm Karen Homan, and I'll be kind of helping us move along today in our discussions. I mentioned a few minutes ago, if you weren't on, that today's a little bit of a different session. We are coming to the close of the ICCP ECHO 2021-22, and as kind of a final session with all of you and all of us together, we wanted to hear the progress that you've been making on your implementation strategies. So again, as we all know, we had you at the beginning of this year look at your National Cancer Control Plan and identify some strategies based on some criteria, things like this is something that the team can work on. This does come out of the National Cancer Control Plan, and this is something that you thought was feasible to make progress on this year. So so we want to hear that, and then we also don't want to necessarily hear all the wonderful things, and I'm sure you have many, but any challenges that you've also had, or also that you've experienced. And how we're setting this up is we're asking no slides. And what we want to do is have you imagine yourself unexpectedly, or now it won't be so unexpectedly, you'll be prepared now if this actually does happen, that the Minister of Health is with you in a taxi and remembering and asking about the ICCP ECHO. So we have got, I think, representation from all of our 4 teams here. So I am going to just randomly pick on folks. We don't have any set order, so I'm going to randomly pick on folks. And I think we'll start with Eswatini and Khaleesi. So are you, and I know you're there, yep. So if you want to take yourself off mute, hopefully. Khaleesi, are you there? All right, well, maybe we'll, oh, there you go. Awesome. All right.
Yeah.
So let me set this up. Hi, good to see you.
Oh, hi, how are you? Good.
Good.
How is everyone? Good to see
Very-
you. It's exciting. Yeah.
Very good.
Yeah.
So did you hear?
Look, I'm just looking forward. In a minute's time, I'm told that I'll be meeting, I'll get a day from the minister. So I'm so excited.
Okay. That is so great. Well, I will pretend I am the Minister of Health and you and I are riding to the airport after a conference. And so I say, Khaleesi, it's so good to see you. If I remember, you and a team of cancer experts were in this year-long ECHO program, and it was about implementing our national cancer plan. So, Khaleesi, what have you been able to accomplish as a result over the past year? And what do you need now that you're kind of ending this year? What do you need to keep the momentum going with the plan? Please tell me.
Yeah. Thank you, Minister. It's such an honor to talk to you, more especially you guys. It's a long queue to come across you, but then I'm excited. I think you quite remember when we were launching the strategic plan. It was like something that is undoable in the country, more especially because it has to talk of the cancer continuum of care that is starting from the information until that individual survive. And the question was, is it possible to have people that can survive of cancer in this country where there's nothing in terms of management of the cancers? And I said, let's just try to see if that's so. So I'm happy that along the way I came across of a certain team which is known as ICCP. They're more on the cancer control program. They're more on the capacity building. So, and that's why we were able to connect with a lot of our colleagues out there in different countries where they have that in probably of low income countries like us. So, but from there, I had a lot of exchange program that I experienced. One of them was the issue of sharing information with the people, that is the awareness. So I was able to touch base with them, and then I learned so many tactics on how to give information, because Minister, for the cancer, treating the cancer, it might be expensive for us, but if we could strengthen our prevention side, that one can work very well. And I've seen it working, because so for those who have been given information, that is sensitization, awareness, they were able to come early in the facilities. They were screened. Of course, if we could focus mainly on the cancer, cervical cancer, which is screenable and also early detected, it yields to good results. So we had to establish that. So most of the facilities that we have, they didn't have 34% of our facilities, which is 243 facilities, 34% of them they were screening for cervical cancer, but a majority of them, some of them had the equipment, some they didn't have the equipment. So we had to identify first those facilities who had the equipments, just to give them information, training the healthcare workers, and also encouraging them to initiate the screening. And I'm happy to say those facilities, as we speak now, they are screening, and we are seeing a lot of patients that have been referred to the next level of care, since they have some abnormalities in terms of their service. So in the good part of it is that, yes, abnormalities, but they were precancerous. So they've been treated using the cryo. I hope you remember when we're taking you through in Babane government, and you were able to see those equipments which we use for precancerous treatment. Yes. So as we were encouraging our nurses, encouraging the population out there to go to the facilities for the screening, and we're doing also the campaigns, going to where they are for the screening. We've seen a lot of them being screened, a lot of them being detected, the precancerous lesions, and they were treated. Of course, we have some sad stories where some of them were being diagnosed in a very late stage, on which they were given some palliative chemotherapy. But I'm happy that through that, you remember when I was sharing the data in terms of the burden that we have in the country, and we got a support from the Taiwan, who said, no, let's establish something in terms of the chemotherapy in the country, since we can do the treatment. By then, we had nurses who have been trained. So we're able to connect nurses with the other doctors, oncologists in South Africa and Taiwan. So we initiated that treatment. So I'm happy to say we have seen an increase in terms of our patient being treated with cancers now through the chemo. Of course, now some of them are being referred to South Africa. And take note of that. Those who are being referred to South Africa for further care are those who are going for the radiation, because we don't have a radiation in the country. But of note, I think we through your support and the leadership, we have seen a lot of our people being treated. And with the support on a collaboration with the ICCP, I think we have seen a lot. In some of our meetings, they were presenting things that probably can be of help to us. And I remember one time I was complaining about our cases being diagnosed very late, whereas the patient would say they've submitted their specimen, but it took long to have the results. And we got a support through the ICCP. We received some consultant, and now we have what is known as telepathology, which means our pathology cannot just do this, but he has other people that he communicates with them in terms of analysis of the data. So these are the things that I think we might get a lot of time to discuss, but next time I'll share with you the pictures of the things that we have done. But in overall, I'm so happy that we are doing now a lot in terms of our services, and we're happy that we got also support in terms of looking at our strategic plan to see where are we, what are the gaps, and then I'm happy to say at least about 80% of 60 to 80% of our strategic plan objectives have been met through the collaboration with other people. I think, can I have some water while we're still breaking? Over to you, Leslie. Thank you, or Karen.
Wonderful. Well, thank you, Khaleesi. We're almost at our meeting, so we only have a few in the taxi, and we only have a few minute or so left. If you need one thing from me, or how could I support you going forward as the Minister of Health?
I think, thank you so much. I think if we could strengthen our telemedicine, because from the telepathology, I've realized that we can do a lot in terms of collaborating with other people on our analysis of our biopsies or specimen.
Mhm.
But then I think if we could also strengthen or work on our telemedicine so that we don't just refer a lot of patients. Some can be managed in the country with the discussions that can be done with other oncologists out there. So I think these are the things that probably I would appreciate to learn more about them. And if possible, we can make sure that we get some funding somewhere where we can procure those equipments that are related to that. So
Wonderful.
I think for now, yeah, and other opportunities if comes of short-term and long-term of training, because we have seen our medical officers, they want to be the oncologists, since the one that we have residentially is not locally. So it would be best to have our local. So if we have chances to train or capacitate our medical officers who are interested on this specialization, that would also include the pediatric oncology. That should be perfect for now. Thank you.
Well, thank you, Khaleesi. We appreciate all of your hard work, and we'll see you hopefully next time, and I can help support those things. Anyways, very nice job. It was a great taxi ride.
Yeah. I would always miss this opportunity, Minister, for us just to chat. Thank you so much.
Yes, thank you, Khaleesi. And I like how you kind of took somebody through prevention all the way through treatment and palliative care, and really made it kind of come alive by talking about real patients. So that was really nice. So thank you so much. Just a couple minutes. Anybody have a question for Khaleesi before we move to our next taxi ride? We will have time at the end to kind of come back, and if anybody has comments, we can make comments. But again, thank you so much. Okay, so our next country will be Nigeria, and I believe Aisha is on. Yeah, Aisha, are you there?
Hi, yes, I'm here. Good day.
Okay, good day. So the same thing with you. I am now the Minister of Health in Nigeria. I'm really changing jobs a lot, or countries a lot. So now you and I are in a taxi, and I would say the same thing to you. So I know that you have been participating in this ICCP ECHO over the last year on trying to implement different things from our cancer plan. What have you and your team been able to accomplish as a result over the past year? And what do you need to keep the momentum going with the plan's implementation? So we've got about 6 minutes before we get to our meeting. So please let me know what you've accomplished and what you need.
Thank you very much, Honorable Minister. That's a really great question. Thanks for the opportunity. So we've had a lot of support from ICCP ECHO. We've made progress in the priority areas defined by the Nigeria team at the beginning of the sessions that we've been having. And our priority areas are really subsets of our National Cancer Control Plan. And one of the areas that we really saw we wanted to make a lot of progress on was on updating our 5-year Nigeria National Cancer Control Plan. It's expiring this year. And one of the things that we've done to just achieve this objective of ours is that with the support of CHI, we facilitated the National Cancer Prevention and Control TWG meeting, where we brought vital experts and stakeholders in the cancer space together to review our plan. And there we agreed on the extent of completion, and also we looked at critical priorities across each thematic area of our National Cancer Control Plan. And then we discussed and identified recommendations to optimize the plan and strategic cancer control strategies. And during our meeting, members agreed that there's a need to strengthen pediatric cancer policy and stakeholder coordination. One of the things that we actually saw was that the previous, or should I say the existing National Cancer Control Plan, did not really have a lot of interventions towards pediatric cancer control. And so one of our objectives this year is to align the ministry's strategy on pediatric oncology with WHO's Global Initiative for Childhood Cancer. Another objective was also the adoption of guidelines and a framework to operationalize and improve the effectiveness of multidisciplinary tumor boards. Another area that we really wanted to make progress on was improving access to quality care. And as you know, we pay out of pocket for most of our medicines in Nigeria. And for cancer patients, this is really hard, especially for families who do not have, they don't really have a lot of resources. So with your approval, we were able to expand our cancer access partnership program, and now we are implementing at 19 hospitals where patients can access their anti-cancer medicines at 50% price reductions. And we also got approval from you last year to expand to an additional 25 centers, so we can expand our access and reach to all patients across the country who may need access to these affordable quality medicines. And also with your leadership, we launched the Cancer Health Fund, which was a fund put together by the ministry just to cover the costs for diagnosis, treatment, and palliative care for indigent patients who cannot afford to pay for their treatment. Because that's really a barrier. Even though some patients have access to these reduced costs, they still cannot afford treatment or even diagnosis for their cancer. And this Cancer Health Fund is now being piloted at 6 tertiary public hospitals in the country. But due to the limited funding available, we could only cover 3 main cancers: breast, cervical, and prostate cancer. And under our Unitate program, with support from CHAI and other key partners in country, over 190,000 women have been screened since January 2021. Approximately 150,000 were screened with VIA and about 40,000 with HPV testing, and about 4,500 women who screened positive have been treated for precancerous lesions, which represents 97% treatment completion rate. And we've had over 1,200 healthcare workers trained and mentored to provide high quality cervical cancer secondary prevention services, including VIA screening and HPV DNA testing. And we also trained over 700 community mobilizers on demand generation for cervical cancer secondary prevention. And over 90,000 women have been mobilized through direct demand generation. Working with the ministry, we're also able to update the National Strategic Plan for the prevention and control of cervical cancer in Nigeria. So next steps for us, really, before we reach the meeting, I just want to go through them. Under your leadership, the ministry is facilitating a validation workshop on the National Cancer Control Plan, and the new plan 2023-2027, as well as the National Strategic Plan for the prevention and control of cervical cancer. This is happening next month. We hope you can honor us with your presence. Additionally, the Federal Ministry of Health is launching standard operating procedures for the implementation of the national policy on chemotherapy safety. This will be done across 13 hospitals which have been selected. And also there's planned dissemination of the Harmonized National Comprehensive Cancer Network, NCCN Cancer Treatment Guidelines, and pooled procurement. And we also did some costing around radiotherapy machines and equipment. So we plan to procure, obviously with your approval, to procure radiotherapy machines for select cancer centers in the near future. Thank you so much for your continued support, sir. Some of the other priorities that we see, and also just things that will need funding for, is on increasing access to diagnostics and screening services for our people, capacity building for our healthcare workers, so really resource mobilization. This has been an issue for us, and with your support, hopefully we'll be able to get some more funding to expand all our activities to reach more people and save more lives. Thank you very much. I guess we're around the block.
We are. We've reached our destination. Thank you so much, Aisha. I mean, so just to say, if I was a Minister of Health, what I really liked about you and what you and Khaleesi did was really put numbers, give actual hard facts to the increase in people screened and the number of people that have been trained. I think as a elected official or a Minister of Health, I think that really resonates with leaders and makes the case that you have been able to make progress and that it's justifiable for you to receive additional support. So really, really nice job. And again, not only with describing that, but you guys have accomplished so much this past year. Really appreciate it. Yep, great job. Yay.
Thank you.
Yes, yes. All right, so now I have gone to a new job in Sri Lanka. And Suraj, I think you're on, do I see? There you are, yes, yes. All right, so you and I are in a taxi, and I would love to hear what you and your team have been able to accomplish over the last year of the ICCP ECHO, and how can I support you going forward?
Yeah, thank you, Minister, asking this timely question because we are just going to complete 1 year of fellowship with ICCP ECHO. I think you can remember in 2020, we launched our 5-year National Strategic Plan on Prevention and Control of Cancers. And through WHO, there was a request from the International Cancer Control Partnership to evaluate a national strategic plan of prevention and control of cancers in Sri Lanka, and they independently evaluated our report. And I think if you can remember, they submitted a nice report highlighting our strengths, and they appreciated that our report, our strategic plan was above average, and they kindly identified our limitations also, and highlighted that that area also, which is very important when we are developing next 5-year plan. We can consider that one, that limitations in the current national strategic plan. Then I think our director, Director Dr. Janaki, and was contacted by ICCP and invited Sri Lanka to join this 1-year ECHO program. And with your blessings, with your permission, 6 of us, our director, Dr. Janaki, 2 consultants, myself, Dr. Upulli, Dr. Muswip, and 2 energetic, our senior registrars, Dr. Sachi and Dr. Suranga, 6 of us joined for this 1-year very interactive program. It was timely because we were in the 2nd year of implementation of our national strategic plan. So one of the limitations of previous national strategic plan was we didn't monitor the progress from its inception. So this experience was timely because while we are trying to implement our national strategic plan with the COVID epidemic, with so many challenges in our setting, so we are on a program with other other countries with the guidance and regular monitoring of international experts. So it is a very catalytic experience where this experience helped this interventions helped us to keep the momentum of implementation of national strategic plan. I think Minister, you can remember when we meet, we met you regularly for the National Advisory Committee or any other meeting to brief you the progress. So you always informed us that we need, even though there are so many limitations of COVID epidemic, so many other competing priorities, we need to try our best to implement our national strategic plan. So the experience shared by other countries who joined this ECHO program was really helpful, because this program gave a lot of priority on implementation and monitoring and evaluation. So rather than just knowledge sharing, the experience sharing was very, very important for us, because we could learn a lot of things from other countries. So that was really beneficial for us. And other good thing was, we noticed that so many international experts, or world authorities in different fields. Now, we had the luxury of listening to Dr. Benjamin Anderson, the World Authority on Breast Cancer. So I think you can remember that we shared the experience that Breast Health Global Initiative, the pioneer, as well as current WHO focal point in consultant related to breast cancer, address this ECHO program. And because Sri Lanka, the breast cancer is the #1 cancer, highest cancer among females. More than 4,500 breast cancers are detected per year. And from you also highlighted that we need to accelerate our activities related to breast cancer. So this interaction with global authorities and their high-level thinking was very helpful for us. So one of the interventions we did during this period was establishing breast clinics. And I think you can remember, because it was a fast-track kind of service where a consultant surgeon or the consultant oncosurgeon or consultant surgeon special interest in breast cancer, breast diseases are heading that team. And up to now, during this 2-year period, we could establish about 25 breast clinics all over the country. So which has paved the way for early attention for females with breast diseases. So our patients were benefited a lot, and paved the way for early treatment, or excluding them not having a breast cancer. So it is a real benefit. So this was one of the major achievement during this period. Then other thing we noticed that to this program, IARC, International Agency for Research on Cancer, was one of the partners, and Dr. Isabel joined as a resource. Dr. Eva joined as a resource personnel, and she highlighted the importance of cancer registry in cancer control monitoring. So in Sri Lanka also, we were trying hard to strengthen cancer registry activities. So it was an eye opener for us about importance of cancer registry, and all our 6 members were highly empowered about that discussion in relation to cancer registry. And during that period, we were able to complete the National Cancer Registry up to 2019, and we were able to submit our population-based cancer registry, Colombo District population-based cancer registry data to the CI5 data call. So this is the first time Sri Lanka submitted to the CI5 data call, and we passed the first barrier, and our data was now we are expecting that final acceptance. So it is from this program, we were able to identify our limitations, and now we are working on further strengthening our cancer registry program. Then other area where we were exposed was the relevant areas related to research, as well as how to implement the implementation science. So those areas were discussed, and our team was highly impressed, and this will be those experiences will be helpful us for implementing as well as monitoring the current national strategic plan. So we have another 2 years and 3 months to complete this current national strategic plan. Hopefully, these experiences will be really beneficial. Another plus point, Honorable Minister, was since we are so happy about this program, we requested another 6 of our team to join our this program for the next year. I think ECHO organizers accepted our invitation, our request, and hopefully, so we are optimistic to join this program to further 1 year. So I think our team can brief further in next year the progress by joining this program. So, Honorable Minister, please support, guide, and give the necessary permission to continue with this program. And from our end, we will brief you the progress for the next year or 2. Thank you.
Well, thank you very much. And that was a very informative taxi ride, and I will continue to support you. Nice job.
Thank you.
Nice job.
Thank you.
I feel very powerful today. I'm granting everyone's wishes, you know. So that was fabulous. Thank you. And again, congratulations on accomplishing what you have. And you've just done a fabulous job. And we're looking forward to continuing our work with you next year.
Right.
Okay.
Thank you.
Yes, thank you. Okay, and our next country is Uganda. And I think it's Nolab that's going to be riding in the taxi with me. Are you there, Nolab? I see you are. Do you have, there we go. All right.
Yes, I am, but I requested Jatho to present because I am on the move.
Okay.
Alfred.
Jatho.
Thank you so much.
Alfred.
Thank you so much, Dr. Nolab, for the opportunity. Thank
Okay,
you
so
much.
you and I, so just let me set us up again. We don't have much time. We're going to a meeting. I'm the Minister of Health, but I want to hear what you guys have done in the ECHO. Oh, there's Nolab's little boy in the ECHO. And what also you need from me going into this next year. So back to you, Alfred. What can you tell me?
Thank you so much, Honorable Minister Karin Homan. It is an opportunity to have a ride. It is an opportunity to have a taxi ride with you, and it is my pleasure to interact with you. Honorable Minister, I would like to inform you that during the last 12 months, we had a very resourceful time in the ECHO program. We are struggling with the development of our National Cancer Control Program plan, the first ever plan Uganda is developing, but through the ECHO program, we are able to obtain a number of resources, advice from key stakeholders and experts across the world, coming from WHO, from the National Cancer Institute USA, and then from other countries. So we are able to use the different country experiences, including the recommendation from WHO and other international organizations, to refine our National Cancer Control Program plan so that we are able to address the local priorities in our country, at the same time meeting the recommendations for international collaboration, international agenda in cancer control. As I speak now, we have completed the development of this plan, and we have harmonized it based on our local country capacity, what the government of Uganda can do, what the private stakeholders can do in cancer control, what the international partners can do. And in this plan, we have tried to make sure the previously fragmented resources that have been used in the health sector in the context of cancer control are pulled together in one pool to ensure that our implementation are all in one line. And as we speak now, we have completed the costing of the plan. All the pillars are costed based on our country capacity, what you can afford. We have categorized the different activities into into the core services that we need to do, and the essential one that will be guided based on the resource envelope. As I speak now, Honorable Minister, our plan has been already presented presented at the ministry level. We finished with the general management level. We completed with the senior management level. Our plan now left to be presented at the top senior management level in the Ministry of Health. And that is the level where you, Minister, you sit in that meeting. So my appeal to you is, Honorable Minister, to ensure that this plan, the process of adoption and approval of this plan is expedited so that we are able to begin working to save life, because we are losing many people on cancer because the resources are fragmented. We are doing less, the funding is not adequate, but through this we can save our country. At the same time, my cry to you, the Honorable Minister, to garner support from your fellow Minister for States and other technocrats at that level so that they can have a buy-in to make sure that this plan is passed. As the technical experts, we are confident that we have done our best to make sure that we produce the best plan for this country in the spirit of solidarity and saving life for our countrymen and women. At the same time, Honorable Minister, you know Uganda is a center of excellence in cancer control in East Africa. So you cannot be a center of excellence without a national cancer control program plan. So if you have that, we shall be able really to defend our status in the East African community. Otherwise, if the Honorable Minister, you delay this program from being adopted, this status may lose it because other countries are also working day and night to make sure they do their best in their country. Honorable Minister, I further appeal to you that when this plan is passed, let it not be like celebrating cancer control just in principles. We should put in practice that the resources that have been included in this plan are provided, what the government provides from the taxpayers' money. And then what is lacking, you can look for support from the private practitioners and from our international collaborators and supporters in this context. Honorable Minister, I know we have a short time to have a ride with you, but in case you have more questions or some clarification on what I've told you, you can ask me in this ride before I leave this taxi. But in case you need to ask me later after digesting this plan, you can reach me on this email address. I have my business card here, Honorable Minister. Honorable Minister, also, since we still have more minutes to have a ride with you, let me let you know that this cancer plan, we are focused on prevention and early detection as a priority, because those are what we can afford. We are low-income countries. We don't have the resources to treat complex cancer cases. But if we put our money right under prevention, early detection, under early detection, we shall be able to identify this cancer early enough, where we can use little resources to save life. Maybe surgery alone could save life. But when you wait for this cancer to spread to late-stage disease, it will be very complex for our country. Otherwise, I still reaffirm that when you put our resources in prevention, early detection, we shall save life, Honorable Minister. But in case you don't have questions, then I can still add to you that apart from prevention, early detection, we are well catered for diagnosis and treatment. We have catered for survivorship. We have catered for policy and advocacy. We have catered for cancer research and surveillance. And research and surveillance is coming very strong here because our country is lacking data on cancer. We are using mainly findings from the neighboring countries and from Western countries. And here we need really to do more to generate local data to inform our interventions and local priorities. Honorable Minister, I beg to stop here. In case you have more questions, you can ask me. Thank you so much for giving me an opportunity to speak to you.
Wonderful. So you have made a very, very good argument for my continued support. And because we are at our meeting, I will follow up with you and talk more about how to help you support the implementation of the plan. Nice job. Nice job.
Oh, thank you, Honorable.
All right. Well, honestly, that was so fun to hear. And in really a short time, the amount of progress you all have made is just phenomenal. And I think that you all deserve a hand. And also, I think it's great how you mentioned, I think each one of you mentioned the support that you got from the other countries on this ECHO hearing what they are doing, hearing their challenges, hearing their solutions. And we hope that you maintain that relationship with the other people that are on the ECHO, because again, I think a lot of our issues are common and a lot of our solutions can be shared with each other for different ideas and different ways to address those challenges. So I'm going to pass it over to Leslie. I don't know if anybody has any questions. We only have a few minutes to get through what we need to with the rest of the session. But if you have any comments, maybe we can do that on anything that anybody said. We'll put those in the chat. And then Leslie's going to ask all of you one more question.
Yeah, so if you do have any questions for any of our presenters as they talk with the Minister of Health, you can throw that question in the chat and we'll see. Hopefully we have time to get to that. But if not, we can, of course, talk offline. So thank you all so much. That was inspiring to hear. And we know that you've accomplished a lot with the implementation of your cancer plan and those few priorities that you identified as we started working together. So our question for you now, and this is helpful to the teams that are continuing, helpful to the new teams that are coming on, which we do have a few, and Mishka will talk more about that. But if you could give the incoming countries to the ICCP ECHO, which we started in November, just one piece of advice as they join to get the most out of it, what would you say? What advice would you give others to get the most out of this ECHO? Feel free to come off mute and share your idea.
Maybe one piece of advice from, this is Annette from Uganda. From our experience in Uganda is to the coming countries to, in low middle income countries, our challenge is documentation and having policies approved and put in place. From our experience in Uganda is that we have really done a lot of things without formal approval and policies in cancer control. But it is being approved by the individual policymakers, the members of parliament, and we're given autonomy, and the Uganda Cancer Institute Act was approved without the cancer control policy. So other than waiting for the written document, which in most cases may even be put on shelves and law enforcement becomes a challenge, they should start with whatever they have informally, as long as it helps to control cancer and save lives in countries.
Thank you, Annette. That's really important. So while you're waiting for final approvals of an updated plan or a draft plan, it's okay to keep moving forward. Cancer doesn't stop, so nor should you. Yeah, thank you so much, Annette. I appreciate that. Anybody else have advice you would offer the incoming countries?
I can go ahead.
Yes.
So from our experience, I would say from what I've learned from ECHO, it's really, you need to set priorities, especially with countries that have very limited funding for their cancer programs. You set priorities, even though you have, let's say 50, just make sure you know, like what can you achieve this year? Like with all the activities, like what would make an impact with the funding that you have. Yeah, and also from one of the sessions, it's really important to cost your plan, just to have an idea of how much you would need, like just to implement. Even at least half of it will be like a big win. And also ensure coordination with all stakeholders in the cancer space, so no one's duplicating efforts. Another thing is demand generation. We had challenges initially with demand generation and also increasing awareness. So awareness creation also for cancer is very important. What else? Yeah, that's it. Thank you.
Okay, great. Thank you so much, Aisha. That's really helpful. Setting priorities is something we talked about a lot with you individually and throughout the whole ECHO. So that in particular rings true, I think. And then of course, costing the plan, we talked about that a lot. We know a lot of you are working on it. Congratulations to Uganda and Nigeria and others who have been able to do that in this time. And so we'll talk about it again for those of you who are continuing, and we'll certainly call on Nigeria to come back and be someone who can give advice around that area. Anyone else, anything to add about other advice you would give countries coming into the ECHO? We have time for one more.
Janaki is here.
Hi, Dr. Janaki.
Yeah. So actually, first of all, thank you very much for ECHO team for giving a very one-year fellowship program. Thank you so much. It was really useful. Then all our colleagues from Sri Lanka, they really like and they really enjoy with your program. And also that we have taken, all of us, we have taken a lot of take home messages, and not only the messages we have taken, then it has been implemented. So one most important thing I want to highlight here is monitoring and evaluation is really important. Not only after the evaluation, evidence should be disseminated to the real the end users, then only they can improve this thing. It is not a fine-fold mission. It should be given to the end user to improve that. In Sri Lanka, we are doing a lot of from grassroots to the central level monitoring and evaluation, especially from the early screening program, breast cancer programs, and cervical cancer program. Then it is continuously monitoring at the small healthcare units, that is a medical office of health, to the top level, district level, then provincial level, then after that central level. In addition to that, National Cancer Control Program is conducting overall national cancer control plans, reviews quarterly in each quarter. Then those things are really important, and giving the feedback and to improve the implementers to improve their work efficiency. But there are certain gaps that has been identified. The clinical audits, that is, it is ad hoc manner, it is happening, but it has to be improved. In addition to that, then thorough waiting list assessment for different diagnosis tests, as well as the radiotherapy treatment, that should be done. Then in future, then we can do those things. Then only we can improve the quality of care for patients who are getting treatment from different modalities. So in addition to that, it is really important to do theater audits, because some of the theaters are not maximally used for oncological surgeries. There are certain places they don't have any problem without any waiting list. They are utilizing in maximum way, but there are some hospitals it is we identified there are certain gaps, so that should be improved. Especially we have to do theater audits as well as the clinical audits. Once again, thank you so much for all the teams, all the people who, all the colleagues who joined with us from different countries. So we really enjoy the program.
Thank you so much. Thank you, Dr. Janaki. And I appreciate that you called this a fellowship. I think that's kind of what we do here. So yeah. I want to say thank you to everybody. In the interest of time, I'm going to pass it over to Lindsay to talk to us about evaluation and next steps.
Great. So in the spirit of monitoring and evaluation, we'd like to hear how you all think we did for the past year, and how helpful we were in supporting you and what we can do better next year. So following this session, I'll be sending out an email invitation with a link to complete an endpoint survey on your experiences in the past year. And as an added bonus, we are giving out certificates for those of you that have done the program and complete the survey. So just want to call on you all to please help us improve and for you by completing the survey. And I think I'll turn it over back to Leslie. Thanks.
Thank you. Thanks, Lindsay. We appreciate your efforts to evaluate what we do, and it's so important. So Mishka, I'll turn it to you to close this out.
Excellent. Thank you very much, everyone. Really appreciated everyone's comments today and over the past year. So I'm going to have us look back a bit and look forward. So thank you very much for the teams who are here today and who participated in this year's ICCP ECHO. Looking back, last year from 2020 to 2021, we had 8 countries participate, 2 of which, Eswatini and Nigeria, you have carried forward with us until this year. And then we were joined this year by Sri Lanka and Uganda, and our team from Bhutan who started with us and was not able to complete. But the 4 of your teams, we're very grateful for all of the participation you've had over the past year. We are also grateful, as have already been mentioned, Eswatini, Sri Lanka, and Uganda will carry forward into our cohort that will start next month. You will be joined by Sierra Leone, Zambia, and Zimbabwe, who are all in similar spaces finalizing their national cancer control plans now. So thank you in advance for welcoming them into the fellowship. To Nigeria, we do wish you all the best, but we also hope that you will keep us posted as you progress. I've listed over here a few ways to extend the engagement, both in this community of practice and within the ICCP community. Please stay connected on Basecamp. We do maintain a regional expert roster. If you are interested in paying it forward and sharing your knowledge gained with additional countries, please let us know. Always you can reach out to the ICCP Technical Assistance Work Group, and we look forward to welcoming you, as Leslie mentioned, for future speaking engagements. So that is it, and a big thank you to all, and back to you all.
Thank you so much. Big thanks to our ICCP ECHO Hub team and to Clay and his team at ECHO for their support. And we just thank you all. And I think with that, we'll end. Thank you so much. And of course, there's a poll. So we have a closing poll. If you could take a minute to answer those questions. As you know, evaluation is super important to us. So thank you so much.
Thank you all. Yeah, thank you so much for your riding in the taxi with me today, and I support everything you said, and we'll give you as much as you want. So we really appreciate your involvement. Take care, everyone. Hope to see some of you at the World Cancer Congress.
Yes.
Thank you.
Bye-bye. Take care.
Bye-bye. Thank you.
Bye-bye.